This is USVI News, your Virgin Islands connection.
Hi, everyone. Thank you so much for joining us for USVI News. I'm Emily Matson. We continue our coverage of St. Croix's LIMETREE Bay refinery as the company announces layoffs of hundreds of its employees, bankruptcy, and closure of the oil refinery. LIMETREE Bay held its first public news conference on Tuesday, addressing the next steps LIMETREE is taking as it shuts down for good. They also addressed a claim against the refinery they say isn't true. Our USVI News' Ali Bourne-Vanek brings us all the details.
LIMETREE Bay says that their press conference and virtual community meeting was a way for them to address the public and also share a status report as to where they currently stand right now in the shutdown process. They also add that the goal was to create a dialogue with the public and answer any questions that anyone has. CEO Jeff Rinker shared that they are working with the EPA on a procedure to remove oil and gas from their facility, and this will happen in the next couple of weeks. The process will be done to put the refinery in a shutdown position for an unknown but most likely long-term amount of time. Next, they'll address their plans in the wake of filing bankruptcy, which happened last week.
As part of the bankruptcy process, we'll begin to explore a potential sale of the refinery assets. Now, before I conclude my remarks, I'm almost done. I just would like to correct just one of the misrepresentations about the refinery that are now circulating around the community. And there's quite a few, but I would just like to address one, and that's about air monitoring. It's been said, and I keep reading, that LIMETREE Bay does not measure or monitor or report the air emissions that are coming from the refinery. And this is simply not true. Under our air permits, we're required continuously to monitor the emissions that are coming from the flare and the furnace stacks using an EPA-approved continuous emissions monitoring system, CEMS, that we call SEMS for short. And this system measures the emissions of gases, including hydrogen sulfide and sulfur dioxide and others. And these are all reported to the DPNR and to the EPA. And in addition to the SEMS, the refinery also operates fixed and mobile monitors for hydrogen sulfide inside the refinery. And we maintain a ring of benzene monitors around the refinery fence line. And in addition to all of this, since late April, although not required under our permit, we have been operating mobile monitors for hydrogen sulfide and sulfur dioxide around the refinery perimeter. Again,
LIMETREE Bay is moving forward in the shutdown process, but they add that their oil storage facility will remain open for business. In St. Thomas, Ali Bourne-Vanek, USVI News.
The Virgin Islands Department of Health has confirmed what it had suspected. The highly contagious COVID-19 Delta variant has made its way to our territory. The Delta variant has led to a huge spike in cases throughout the nation, and it's now been identified here as the health department continues to push to get more Virgin Islanders vaccinated to prevent the spread. The Delta strain is now the dominant strain in the United States and is highly contagious. Health leaders say these mutations can make the virus more severe and could potentially cause it to resist the vaccine in the future. The sooner more residents get vaccinated, this risk of this virus mutating will decrease, according to health leaders. So far, 84 samples of the positive cases here in the VI have come back positive for COVID variants. 12 have come back positive for the Delta variant, with 65 being the UK variant. New cases continue to rise amongst unvaccinated individuals here in the territory. As of July 20th, there are 165 cases in the territory, and the positivity rate is currently 4%. There are currently 59 cases in St. Croix, 101 in St. Thomas, and 5 in St. John. The VI Department of Health says identifying this variant is in one district only indicates that it has already covered the whole territory, as an inter-island travel heightens the spread of the virus. Again, most of the positive cases and hospitalizations are among unvaccinated individuals, so the health department is urging people to get the vaccine. Meantime, a new study is suggesting the Johnson & Johnson coronavirus vaccine may be less effective against the Delta variant. Researchers analyzed blood samples from people who received one of the 3 authorized COVID-19 vaccines. They found the Johnson & Johnson vaccine was less effective against the Delta and Lambda variants, and scientists say it could result in decreased protection. Now, this may mean those who got the single-dose vaccine could need a booster from either J&J or another vaccine maker. Johnson & Johnson's chief financial officer says the results were based on blood samples in a lab and may not reflect the shot's performance in a real-world setting. The company also says a smaller study showed the vaccine did offer protection against the Delta variant. But here in the Virgin Islands, health officials have been administering both the Moderna and Pfizer two-dose vaccines since they started administering COVID-19 vaccines in the territory. And as vaccine makers ramp up their COVID-19 testing on children under 12 years old, there's a renewed push to get kids vaccinated as soon as possible. This as schools get ready to reopen for the fall semester. Reporter Steve Nanes reports.
Kids heading back to school, the COVID-19 Delta variant surging, and pharmaceutical companies conducting vaccine trials for children under 12. So, when will shots be available for kids?
We are hopeful we have a safe and effective vaccine for younger children before the year is over.
The CDC director making that prediction during a Monday virtual meeting with a group of 24 business groups and public health organizations. The group announcing an initiative to help working parents get their eligible children vaccinated against COVID-19 and get caught up on routine vaccinations. Meanwhile, Pfizer and Moderna are still doing clinical trials to see how coronavirus vaccines work in children under 12. Pfizer saying data for children 5 to 11 could come sometime in September. And depending on the findings, it could ask the FDA to authorize emergency use of the vaccine for that age group that same month. Moderna has not said when it could potentially have its trial data results.
We still don't have the complete picture as data in this age group are limited, but we do know that even children with mild cases of COVID may face serious long-term effects.
Right now, all but 4 states are seeing an increasing trend in new daily COVID-19 cases, with doctors describing patients who are younger and sicker than those they saw in the winter. Health experts say right now, the best way to protect young children is to get shots into the arms of everyone else around them.
The ones who will also pay the price, other than the unvaccinated adolescents, are the little kids who depend on the adults and adolescents to get vaccinated in order to slow or halt transmission.
The chief of the Tokyo 2020 Organizing Committee did not rule out a last-minute cancellation of the Olympics. At a news conference, he said he would keep an eye on infection numbers and confer with other organizers if necessary. In his words, quote, "We will continue discussions if there is a spike in cases," end quote. Several athletes have tested positive for COVID-19 in recent days, and coronavirus cases are rising in Tokyo. The CEO said, "Cases may rise or fall, so we will think about what we should do when the situation arises." The Games, postponed, of course, for a year because of the pandemic, will be held without spectators. Japan said athletes would compete in empty venues to minimize health risks in the spread of COVID-19. Organizers report 67 cases of COVID-19 infections in Japan, among those accredited for the Games since July 1st, when many of the athletes around the world and officials started arriving in Tokyo. Nightlife is continuing in Tokyo despite government efforts to curb the spread of COVID-19, but that has not led to a lockdown. The government asked restaurants and bars to close by 8 p.m., if not entirely, but many bars remain open and bustling with customers who are defying the rules, and a lot of people are just taking their drinks outside. Health officials see drinkers as key spreaders of the disease, but have failed to deter many from enjoying the nightlife. So, of course, here in the Virgin Islands, we are used to the hot weather, especially during the summertime months, but just days before the opening ceremony of the Olympic Games, the temperature in Japan's capital, Tokyo, topped 91 degrees Wednesday in what local residents were calling an abnormal summer. The country's weather bureau has actually issued heat stroke alerts for several consecutive days now. While the immediate challenge of holding the games amid the COVID-19 crisis has overshadowed almost all of the other concerns, heat has been a long-standing worry, of course, when you have a lot of people competing outside in these hot temperatures. Summer temperatures in Tokyo can spike to 95 degrees or more.